biological material has broken down, it creates chemicals. You ever wonder why a dead animal smells so bad on the side of the road? Well, because of the chemicals that it's putting off as the biological tissues are breaking down, right? All the cells are breaking down and they're releasing their own chemicals like ammonias and so forth, okay? So then you have solutions on the back table that the instruments are going to be, subject to. The scrub tech should be putting basically a basin of saline, a basin of sterile water, and some kind of receptacle for like alcohol, right? Well, generally speaking, my observation has been that the latest generations aren't doing a very good job of putting the sterile water on the field. And so throughout surgery, they're rinsing the instruments in saline. Well, that's no bueno. We all know that. And then when you talk about, cleaners, a lot of times we're not worried about that anymore because, we're so caught up in our suppliers are giving us the right kind of cleaners for instruments, and we're not worried about alternate effects. If you see instruments that look like they're getting effects of, acids or alkaline materials that are staining the instruments, and at the end here, I'll have a couple of key hints on what might be happening to your instruments based on the kind of staining you're seeing. But those kind of things need to be checked periodically. Make sure to look at what the cleaners are intended to clean, and are the instruments that are getting cleaned in there the right kind of instruments. Does that make sense? So they're constantly getting bombarded with other kinds of things as well. The iodines, that's really caustic to instruments. And I'm not gonna lie, I've been in some rural SPD departments that literally had Comet on the back sink in the decontam that they would put on the instruments to help scrub them off a little more. So it's good for your macaroni and cheese pan, but not good for the instruments. They're going to come into contact with a lot of other metals. Obviously, they're going to bang around in those instrument trays. Those instrument trays are full of different metals, different steels. We've talked about that because of how the instruments have to be, made with hollow parts. You have aluminum handled things like mallets, maybe that might have an aluminum handle and a lead head. Again, you can see some of the other metals, and obviously are copper. You're going to have titanium. You're going to have silver. All this stuff is coming together. Well, each of these metals actually has an electrical charge. Okay, not to get too physics on you, but the physics of these metals is such that they have their own charge, and when these touch each other, they start to lose components of themselves to a more dominant charge. Okay, so if you've ever seen gold handled needle holders that look less gold, right? You've got black handled scissors that look less black handled, right? Well, what's happening to that? Well, it's not coming off on the surgeon's rubber gloves. Okay, it's not coming off just because they're touching something. What's happening is those instruments go through a process of basically changing their electrical charge, and so the metals that were anodized onto the instrument are coming free of the instrument because of another electrical charge that's stronger and it's pulling it off. Okay, a lot of that's going either to another instrument, making it dingy. That's another reason why some of the instruments look dingy, or it's going right down the drain. Okay, it's a normal part of the process. It's so hard to avoid. The only way you can avoid it, guys, is to segregate your stainless steel instruments from your titanium, from your hollow handled stuff that has a lot of like nickel and stuff in it, from your silver. And that's just not practical. In an ideal world, yeah, but you don't have time for that. So these are the things you're going to see the instruments experience through the process. All right. We always want to be sure that, instruments are used for the designated purpose, but that's not on you, right? That's on the surgical team. And then, this is an emphasis I try to make with scrub techs is, their job is to know how to get these things fairly clean right after the use of the instrument when the procedure's over. All right, next slide. Next slide. Thank you. So, one of the things I try to impress upon them is they're the first stage of decontamination. It's critical that they be wiping off instruments with sterile water, not saline. And we want to make sure that they're actually flushing instruments that are cannulated as well, throughout the process of the surgery. Again, what did I say? Most of the time they're wiping with saline. Okay. And what are you going to do? The only thing you can do is go to your leaders. If you notice that you're seeing a lot of pitting and damage on the instruments, if you notice the instruments are coming back in basins of saline, the best thing you can do is get your leadership to talk to the OR leadership and let's set a new standard. Because I guarantee you that's not in the SOP currently. Put instruments in saline. It doesn't say that anywhere. Trust me. And of course, I'm always willing to come and try to in-service the operating room staff if you think that would be effective. So anybody worth their weight can come and in the instrument industry can come and talk about the damage that's done to the instruments if they're only subjected to saline in the OR. Okay. Next slide. So certainly after the procedure, it's in all of our best interest to make sure that the instruments get cleaned as rapidly as possible. We don't want them to sit there and get dried up. It makes it much harder and puts a lot more time in the process of getting the instruments turned over because you've got to let them soak. We don't have time for all that soaking, right? I mean, if the operating room understood that sterile processing their focus should be on quality assurance, not on just cleaning. We're not dishwashers. We're quality assurance experts. But you have to have the time built in to the process to be able to look at the instruments, to find that they have no bioburden on them, to be able to check them for correct function, all those things, right? Well, it starts at the earliest phases, which is right at the end of surgery, right? So we got to get them back into decontam as quick as possible so we can start to remove the saline that they inevitably got contact with in surgery, the blood, all the contaminants, and so forth. Most hospitals have something in place where they're recommending a pre-enzymatic cleaner that they spray on. It's a gel, it's an aerosol, it's something. A lot of hospitals also implement a process where, a wet towel, hopefully with sterile water, but a wet towel is put over the instruments. I see that happening, but what kind of water are they using? They're putting the towel in the saline basin, and then they put that over the instruments. So that's no good either, right? But at least it's wet, keeps the instruments, I guess, moist. I see hospitals where they segregate the soiled instruments from the instruments that never got used. There's a lot of different processes out there, right? And, the guidelines within AAMI, as well as, ISHM, those give really good guides on what kinds of SOPs can be effective and, what's considered appropriate, okay? Obviously, with anything that has moving parts, we want to get them wet quick so that the moving parts don't get jammed up as well, because that's a critical component. If a clamp or a scissor or some kind of forceps that you got to hold something with, needle holders, if they don't move, what's the point? All right, next slide. This is something, critical part of the decontamination process, especially after the surgical procedure, is kind of putting like instruments together, right? We've all heard, you don't want to put the lighter, delicate instruments on the bottom and the heavy stuff on top because that could be damaging. Well, and that is true. But it's also about how do we get an effective coverage of a pre-enzymatic cleaner? If everything's all jammed up in there, going every which way, and there's no real order in the basket, it's like spaghetti junction on Friday afternoon. It's just crap everywhere and it's all jammed up. Well, you can't, the enzymatic cleaner may not get all the parts it needs to get to. So ideally, we're separating your instruments out. Your delicates go to one place, your heavier ones on one side or whatever. You're putting like instruments together. You're opening up instruments with hinges, and you're spraying them that way. And then if we have different metal types, it's, again, it's best to try to separate those. You know, if you got mallets and stuff, they should generally be in a different location, right? Than on top of, you know, your finer elevators and your anything with a sharp surface and stuff like that. All right, next. You know, there's various techniques for washing and rinsing, of course. Some of this is going to be covered in an instrument or a piece of equipment's IFU. You guys do a lot of stuff that's hand washed, you know, obviously scopes, cameras, things like that. Some of your more delicate instruments are probably going to be hand washed as well, depending on your facility's, you know, processes. But we obviously want to get them into a big hopper, like a big hopper bin, and spray them with pretty good stream of water. And then we're going to probably, you know, spend time making sure they're fairly debrided of all the gross bioburden, you know, the big chunks and pieces before they ever go into the washer, right? And so the other thing that should be looked at is an instrument that's been tagged as broken or something. You know, take a look at it. If it has fractures in it, obviously, if the tip of a scissor is busted off and it's been clipped, you know, needs repair or replace, what's the point of cleaning it? You know, just chunk it. Well, depending on what your operating processes are, but you know, that's not one that is going back in the tray. So usually that could be segregated out. So anyway, next slide. Let's see. So I don't really love this slide because it says something to the effect of it should be lubricated once a week. What does that have anything to do with it? It should be lubricated probably every time, right? And so most departments now have washers that have a lubrication or a milk stage in the washer, okay? So anything with moving parts should not need lubrication to work effectively, okay? If an instrument is having a lot of friction, okay, there's something wrong in the hinge, right? And if it won't move effectively without lubrication, then there's something wrong with the instrument. So pay attention to identifying that there's a problem. Don't just put the Band-Aid on the problem. With that said, lubrication helps the surgical team or your surgeons have a more consistent experience with the instrument, okay? Something like a kerosene, you know, a couple of key lubrication points, and your surgeon's going to have a great instrument that glides. You know, scissors and needle holders, if they get a little milking phase, they're going to work so much more smoothly. But they should be able to work without the milk. That's my point. If they have to have any kind of lubrication because they're stuck or they're stiff, then there's a bigger issue. So pay attention to that. And then, of course, we got to make sure we sterilize them the right way. Stainless steel instruments generally can be sterilized in the steam sterilizers. Obviously, that's the most common method of sterilization. But you need to make sure you're familiar with the instrument IFU in the event that there's alternate methods that are also appropriate if needed. Okay, next slide. You know, we're going to go over a few do's and don'ts. These are pretty obvious. We've already talked about all this stuff, right? You know, we want to make sure instruments are rinsed effectively, whether they're at the point of use, whether they're post-operation, you know, post-operatively, we're in decontam. We want to make sure we're rinsing them and putting a pre-cleaner on there and doing an effective job of that on the front end, right? If you guys see that trays are coming down from the OR not sprayed, and that's part of your protocols, it's important that you make it a point to address that, because it's going to affect how long it takes for you guys to get instrument trays turned over. If instruments have to sit around and soak, and you guys all know this, you don't have as much time to do your quality check, right? Does the surgery department want instruments that are clean with no bioburden? Yeah. Do they want instruments that work right the first time? Yeah. Because if not, they got to go looking around for an instrument in a peel pack or go open a whole nother tray. So, you know, you guys have probably the hardest job in the hospital, which is get his stuff clean and make sure it's working right. Well, that's all QA, right? Quality assurance. And if you don't have time to do that because the schedule's so compressed, they're in a hurry. Turn the trays over. You're going to miss stuff. It's just human nature. Okay. So if you're finding that, if you see something, say something, right? I mean, I think everybody's heard that before. Obviously, instruments with hinges and working parts should be, in a non-locked position, or at least have the jaws open so that steam can penetrate correctly, or any of the sterilants. And then, of course, we talked about lubrication. All right, next. So on the don'ts, the first one can be a little misleading. All right, there's some, we know the standard of, if it can come apart, it needs to come apart, right, to be washed and decontaminated and sterilized. But what we're really addressing is instruments that have, screws that are intended to keep them together like permanently, right? So that's why we kind of put that there, because things like scissors, right? You're not going to take the screw out of a scissor. It's kind of silly. But there's other things where there's been a lot of dispute on, do you need to say undo the nut on vaginal speculums every time, right? Because those go, where do they go? They just disappear, right? So is that a requirement? I don't think I've ever seen it anywhere. It says you have to take the nut off. It's not in an IFU, not that I've ever seen, but that's a constant conversation, right? Do you take that nut off or not? Well, if you do, it's usually lost. So I know part of it is addressing, the threads. You want the threads to get cleaned. So I think that's natural to want to disassemble to make sure it gets cleaned, but maybe address reassembling it before it goes through the washer, right? So those are some conversations to have. Delicate instruments, they need a little more care, right? You're going to have to wipe them. You're going to want kind of lint-free type cloths to wipe them with, to clean them up good. You don't want bioburden to dry. So obviously, do not allow that. And then we don't want instruments to be overcrowded in the surgical pans, in the baskets, because it can create kind of dead spots when the steam's trying to cycle through to sterilize, right? And then the last one I don't love is do not mix metals. And we say that because we kind of have to, right? Because we told you and we already know this, all the different metals have a different impact on each other, but it's just really almost not feasible at all. I do see some hospitals implement a segregation within the trays, so they maybe put, certain instruments in another little separate compartment, a different layer in the baskets. So I do see that happening for sure. That's as much to protect the instruments from, other wear and tear as it is separating the metals. But, it's just not a feasible aspect of instrumentation. So we do encourage you to separate metals, but it's really hard to have a separate little container over here for titanium needle holders, and then you got the whole CV tray over here. So I got to pull 2 trays for one case. Some hospitals do it. That would be what most people would advise for sure, because you're separating those metals. But a lot of folks recognize it's not feasible. All right, next. All right, so we all know the decontam process. Let's go to the next one. We've talked about this too. I mean, we're flying through this, aren't we? I think really part of this, when you look at a disassembly of items, you're also looking at identifying items that maybe aren't going to endure the cart, the washer, right? So you're going to hand wash some things, but these are usually be in a separate tray anyway. So separating heat and moisture sensitive items is generally already done because you've got them in different pans. But definitely take care to note which things can't go through the process of the stainless steel instruments, and make sure those are taken out ahead of time. And then obviously we want to soak things and rinse them in the decontams phase. All right, next. It says do not wash microsurgical instruments in in the big washers. So the rationale with that is because these instruments may get banged around and they'll get beat up. You're talking about delicate eye instruments, maybe your delicate ear picks, things like that. Really, really delicate, delicate edged scissors or something like that, for really micro type surgeries. The real recommendation should be: do not put them in those without an effective container. Right? You want them to be in something that maybe has the rubber mats, so the instruments aren't banging around, so they can get their full washing and get penetrated. Because you got the container with the perforations on it or something. But what we're really talking about is don't send those through loose. The water, the chemicals, all that stuff is fine for those instruments, right? They're made of stainless steel. Even delicate eye instruments. I've listened to departments say, "Oh, we don't wash our eye instruments in any kind of a cleaner solution," because they're worried about TAS. Okay, but there's still biological material in someone's eyes, and if you don't clean the instrument effectively, then you may cross-contaminate to another patient. So the real issue with something like TAS, because I hear it all the time, right? The real issue is effective rinsing. It's not whether it went through the washer or not. It's did it get effective rinsing? So that's another aspect of, if you put fine instruments like that into the washer, is the cleaning, the rinsing water getting fully penetrated to the instruments for that kind of delicate instrument to remove the risk of something like TAS? Okay, so that's kind of the whole conversation there. So general rule, don't put all the micro delicate stuff, into the automatic washer. But why? Right? So if you're taking care of the whys, then it can be okay. Again, the rinse cycle is the most critical component, I think, as well as potentially the instruments getting beat up. All right. Now, I told you that I've seen departments using, what did I say it was? Comet, because it was Comet. So I've seen departments using Comet. I have literally seen on a back sink in Deacon Tam, I've seen them using a razor blade, to scrape stuff off of an instrument. I mean, look, if we got to do that, then we got bigger issues. That's an OR issue, and somebody really needs to sit down and have a come to Jesus meeting with them. All right, because if we have stuff that's so stuck on that I got to implement, steel wool to get it cleaned off, that's not good. Make sure that we're only using like the soft bristled brushes. We're not using the steel brushes, because these kinds of abrasives will affect that passivation layer that I talked about at the beginning. Okay. And that passivation layer is really important to help the instruments stay protected when they're subjected to all that saline and OR. All right, next. So the ultrasonic, it's like my favorite piece of equipment, I think. Yeah, it's my favorite. And it's my favorite because of what it can do for your instruments. Okay. Now, I will tell you, it's probably one of the least used. Yeah, it's probably one of the least used. And it's because it's extra time. And most departments don't fully comprehend why it's so important for the instruments to go through that process. It's like an extra washer. Why do we got to do that? It's already been rinsed and going in the washer, and we don't got time for all that. That's generally the attitude I see, right? Well, here's why it's so important. The ultrasonic, it's also called a cavitation cleaner, uses sound waves, all right, to create tiny little bubbles, right? These little bubbles. And the bubbles stick to the surface of an instrument, even down into the tiny little space between, the screw and the hinge, all right? So these bubbles get all in the tiny little surfaces, anywhere, even in that little box lock, okay? Even throughout anywhere in this kerosene. I mean, how many times have we heard there's all kinds of bioburden inside the kerosene, right? Well, the ultrasonic is a critical component for helping you combat that, right? And so if you put in the ultrasonic cleaner, not only an enzymatic, but also something like a mildly acidic compound, there's several out there. Ruhoff makes a really good one. I'm not trying to promote Ruhoff here, but it's top of my mind. But most of you guys have maybe seen Surgistain, Okay. Surgistain is a mildly acidic compound that helps recreate and refresh